Hi everyone, I am Kim Congo and I get the privilege of starting off tonight's community crossfire because we have women power here, right?
Yes.
So I am here with two fabulous ladies from our community, both of them very well known and just great people, I can honestly say, because I do know both of you. So sometimes you see people I really don't know, but knowing both of you, I do know that you are really dedicated to what you believe in, that you walk the walk. Sometimes you get a lot of people who talk and they're not quite as active, you know, but you guys stay very active, letting the community know how much you care.
Yes.
And tonight we're going to start off, I guess your shirts say it all. Okay, so I apologize. Let me let you introduce yourselves because I know you, but they don't.
Dr. Anderson, I'm the Executive Director of TOVA Community Health. I've been working with the Sickle Cell community for 20 years.
Wow.
I started out working with children at the Mary Anderson Comprehensive Sickle Cell Center, and then about 6 to 7 years ago, helped to start and launch a community-based adult sickle cell clinic here in Delaware.
Wow. Okay, so that was even more than I knew. So wow.
Yep.
And next to you we have?
I am Shay Fawcett Robinson. I am the committee chair of the James Fawcett Sickle Cell 5K. We are going into 7 years. My passion came from my experience of living with my late husband with sickle cell, and we wanted to really do something to empower those living with the illness and just to kind of bring the awareness forth. So really to try to help other families based on what we experienced in regards to the illness.
Isn't that amazing? So that says a lot because sometimes when we're deep in our pain, and it is pain, we don't take time to say, you know what, somebody else may go through this, how do I help them? So just that you care enough to help somebody else and say, you know, it was hard. And these are some of the things you may experience. And you know what, that's good for people whenever we're going through something. It's good to know we're not alone.
Yes,
Absolutely.
That is just so just comforting when you hear someone else say something, you're like, oh my gosh, I'm experiencing the same kind of thing. So, you know, maybe it's not just me. And then for yourself, wow, I had no idea that for 20 years you've been so active. So what started your passion in this area?
Well, actually, it was such an unmet need. When I started, I worked at the AI DuPont Hospital for Children, and that was in the mid-90s when I graduated from University of Delaware. And I noticed that there was a difference in perception in the way healthcare providers treated children who came in for crisis. And I would always see them sort of like writhing in pain and just feeling like people were just dismissing them or saying, oh, they're difficult patients to take care of, and just wanting to really make sure that they had a good hospital experience, that their pain was managed properly, and that we did all we could to keep them comfortable and make sure that they had a good outcome, led me to continue this work. And in 2001, I completed my master's, and then in 2012, my doctorate in nursing practice. And through all of those years, I've worked with children with sickle cell. I helped to launch a transition program at the hospital, as well as I ran the bloodless conservation management program there too. So I've always wanted to work in an area where there was an unmet need, because that's what my parents taught me to do when I got my education, to come back and serve my community. And since sickle cell was one of those unspoken chronic conditions, and when I started this and really providing this really grassroots effort to get the awareness out there, people really didn't know much about it. They were really not as vocal, sharing their experiences, and I've really seen that change over the years, and I'm really excited to see now that there's a lot more attention paid to this. And just this year in 2018, there's a second drug that has been launched that was approved by the FDA. It's called Indari. And so we have a lot more options that we've ever had to treat persons who have sickle cell and their complications than we ever have done in the past. So I'm really excited about that, but it's just a passion of mine. I think people have their own niches and areas where they really feel passionate and want to serve in a specific area, and that's just mine has been sickle cell.
All right. Okay, so since we have you here and you're so knowledgeable, I want you to, I know it's not part of my questions, but I'm going to get you to break down for the viewers what sickle cell is and how it affects, because we hear sickle cell and we know it's bad, but we really don't totally understand all that it is and how it affects people and how hard it is. So we've got somebody here who can speak and also break it down for us. So why don't we take advantage of that?
So sickle cell disease is an inherited genetic blood disorder that affects the blood cells. And the blood cells are misshapen, not nice and round like a round donut. They're shaped like a C. And so under certain conditions, those blood cells break down, they clump together, and they deprive the body, the organs, the bones, the tissues of oxygenation, nutrients, and as well as circulation to those areas, and that causes excruciating pain and other complications. We estimate about 100,000 people in the United States live with sickle cell disease anemia, and about 1 in 12 African Americans can carry the trait.
Now that's an important fact that you said right there, because carrying the trait. So help us understand when we carry that trait, how we need to know if we're dating somebody with that trait.
Yes.
That's important. Can you share that with us as well?
So if you have the sickle cell trait, that means that you still have a sickle gene on one of your chromosomes. You have 2 on each side. And that you can pass that sickle cell gene on to your children if one of your partners carries a trait or another type of trait as well. Shay's son carries the sickle cell trait, and so it's important as he grows older that he knows that status of his partner, because there is a 1 in 4 chance if both parents carry the trait that they can have a child with sickle cell disease.
Okay, and I'm going to get you to say that out loud again for everybody who's listening, because it is so important. A lot of times, you know, we're talking about all these other things that we have to check for when we're getting a mate. But for those people who do have the trait, it is so important that they pay attention to that, because it's, you know, it's just so easy to, you know, have a child with that that has sickle cell, rather than, I mean, you may have one, of course, with just the trait, but when you do have 2 partners with sickle cell trait, those chances go up, and it is just, it's something that we need to pay attention to.
Absolutely.
So, but it sounds better from we get Dr. Anderson to say it. It sounds so much more professional. So tell us once more how it works.
Okay. So if you have sickle cell trait, you have a sickle gene on one of your chromosomes. So you have 2 sets of chromosomes. You can pass that sickle gene onto your child. So if both parents carry the sickle cell trait, there's a 1 in 4 chance with each pregnancy. That means that each pregnancy carries the same chances that you could have a child with sickle cell disease. Now there's other types of traits as well. We call them hemoglobinopathies, but that's a bigger discussion that can cause a person to have a child with sickle cell as well. And so it's better to check the blood to see what's going on, I say.
That's it. So has to be one of your date questions.
Yes, you say,
So
you asked about your HIV status,
that's
about your sickle cell trait status.
So for those people who have the sickle cell trait, it really is important that you ask your mate or whomever you're with if they also carry the trait.
Absolutely.
That's so important. So now let's talk about our fun walk coming up. We did all the hard stuff here. Let's talk about that.
So I will defer that to Shay. I do want to say that I want to thank Shay for all of the years that she's worked with me. James was actually my patient who passed away in his mid-40s of complications of sickle cell anemia. And at the time when I first started launching this effort to provide community-based care to adults, was his idea. And he really felt very passionately that we needed more awareness in the community about sickle cell, and that people needed to know what an adult's life journey was like. And so as we were preparing to do this, he passed away, and I really wanted to continue that vision, because it was something in many of the meetings and conversations and visits that I had with him that he felt very important about. So we've been very thankful that after 7 years, we're still here and able to do it with so many challenges, as you know.
Right.
Fundraising is not an area of expertise of mine, and getting
always
sponsorships is quite a challenge. And I want to say, and before Shay talks, is that for 7 years, we've never raised the price.
Okay.
And it's been the same $20 for participants and $10 for students. And then because our families and our community have economic and financial challenges, we still tell them to come.
That's right.
So if they can't pay that money, we say, can you volunteer? Can you bring something? And you know what? At the end of the day, of all the years we've done that, we've still been able to turn a small profit and then return those funds back to have money to do it the next year. So we're prayerful that that will continue as well.
Yes.
And before you talk, I do want to say something, and I apologize for bringing it. So I guess I knew, and I don't know if anybody else is out there is like me, that you kind of hear, but you really don't understand. So for you to talk about the pain, and for those of us who knew James, it's like, are you kidding? He was in a lot of pain, and we didn't know.
He was. Yeah.
And because he was just always so great.
Yes.
It's just such a fabulous person. So you never, I guess people hide the pain, or don't share that part of things. And so I really didn't realize that there was a lot of pain with sickle cell.
Oh,
I don't know
absolutely.
anything about it. I
Yes.
hate to say, other than know what it is. Like you get to learn the sickle gene and all that stuff. But to know that people who are suffering are in a lot of pain just is surprising to me. Only because every time I saw him, he was just fabulous
And
loving,
anemic. Full of
life, right?
And anemic.
I
Running a
mean, just-
hemoglobin of like 7 or 8 or 9.
Actually, he got
which
down
makes
as low
you
as a
very
3.
tired.
Yes.
And you never saw that in him.
Right.
So my gosh, that even raises the bar for me with him. And
Yes.
if you can, because just as far as great people go.
Yes.
So it is nice that we are able to honor such a fabulous person
That's
as well.
good.
So I know you would have anyway,
Yeah.
but the community thanks you too
Thank
for keeping the awareness going.
Yes.
Because it is hard. You know, how many things can sustain. So you get to tell us all about the walk. What we
Okay.
do.
And just speaking on that, the passion came out of the experience that he endured, and me watching him endure that process, as Nina spoke to it earlier, in regards to the treatment and the lack of support that we experience in that area.
Right.
Being treated as if you're coming in just to get a quick fix. Needing to understand, how sickle cell really impacts the individual and their body. And that passion came out of, just those experiences and wanting to bring awareness to, the state of Delaware. There's a lot of things going on in other states. So that's where that passion was, driven from. And we also, during that process, we met a lot of other families impacted by sickle cell.
Okay.
And we wanted to educate. So we were ones that educated ourselves on the illness, understanding the type of sickle cell that you had, that they live with, because there are various types that people didn't know about. And then speaking to other patients, they weren't aware of that as well. We connected them with Dr. Nina, and we connected them with other, doctors, hematologists, and so whatever they needed, and to support them through that process. And we move forward with this walk. So we met, going back, we'll go back and give Trippy, the credit for introducing us, because he shared what we had, what our vision was and what Nina was already doing, and the passions just came together. And unfortunately, he didn't live to see that come to fruition, but we pressed on.
That's right.
Just he had that same stamp. Like you didn't know what he experienced because he had that ability to press, and we continue to press on through the process. Through the pain. And we have, for 7 years, this walk has become a staple in the community. And we're so excited and proud of it. So this year is going to be the 29th of September. This is National Sickle Cell Awareness Month.
Is it? Okay.
Yes, it is. So we are looking forward to a great celebration. This year we're calling it the James L. Fawcett Sickle Cell Empowerment Walk, because we want to empower people with information.
Good.
And not just about sickle cell, but other things as well. So we talk about, we talk about knowing your status, and
Okay.
it's very important. Like, I educated my son. You know, it's important. Hey, how are you? My name is James. Do you have the sickle cell trait?
That's
You
it.
know, it's one of those things you want to ask the first couple of questions. But the walk is going to be exciting. You know, we're going to have the same things we had before and some other new things coming. You know, so we're going to have, you know, food and some other different entertainment. So we want to keep it a surprise.
Alright.
But we will have
Yes.
like the moon bounce for the children. They'll keep them active. We will have the participation of our walkers. You know, we have some dedicated people who come out and support us
Yes.
every year.
Yes.
And it's so exciting to hear people talking about it, asking about it. Are you still having a walk? Yes, we are. We are advocates about just bringing this information forward, you know, because we've always said this is unspoken.
Yes.
You know, we
Yes.
hear a lot about it now, which is great. It's
But
really
still
great.
not enough. Because
It's not
I know
enough.
I don't hear
It's
a
not
lot
enough.
about it.
But it's more
And
than we've
still-
heard.
Yes,
Yeah.
it's more than we've
It's more
heard.
than we heard before.
And again, I happen to have a child. She's not my birth child, but grow up with some. Well, I have raised her. Who
your
had the
child.
trait? So she's
Yeah.
my child
She's
too.
your
Yes.
child.
So I
That's
share
right.
her with her mother. So okay.
Yes.
But she had the trait. So with that, I became aware. I was like, oh my gosh. And it was something that I never knew. So because you have never encountered it, a lot of times we don't know. So again,
Yes.
that lack of awareness and making certain that we are sharing this information
Absolutely.
and that we are finding out our status. Because perhaps you don't know your status because it had never, if you carry the trait, you may not know
Right,
that you carry
exactly.
the trait. And
That's important.
it's
to know.
very important to know. And I know, I can remember her saying she met somebody and then she found out later that he carried the trait. Because
Wow.
once I knew, I said, well, I always told her, you know, make sure this person
Yes,
you're asking about
absolutely.
this. So
And one other thing with that I've come to find out is some people with the trait can actually experience some pain, not a
Really?
crisis, but they
Okay.
can experience some pain. And I can speak to my son. He's
Okay.
experienced some of the pain that his dad experienced, which is
Wow.
interesting. He always talked about the lower back pain,
Okay.
you know, pain in his legs. And those are some of the things his dad
Wow.
talked
And
about.
I bet they don't even know that
Yeah.
it could be from that,
Yes,
you know,
absolutely.
and they're thinking, oh, I lifted something, and we just don't
Yeah.
know how to look into it. And now we find there may be something they can do, and they wouldn't know that
Exactly.
because they haven't thought that it may be connected because we
Yes.
don't really look
Yeah.
at it. But
Because a person, even though they have the trait, they still make sickle cells. It's
Okay.
just not enough to cause a full-blown sickle cell disease. But
Okay.
we're finding out more that trait is not as benign as we much thought.
Okay.
And so we have people that have been sharing with me, and I have patients who have the trait, so they get mini crisis or they get
Wow.
pain in their muscles and their back when they're exercising and they're not hydrated well, and or if they go to an area of high altitudes that they
Yes.
get into problems. So I think it's an area that really needs to be studied more,
Okay.
because there are a lot of people that have the trait, and we've always dismissed it as
Yes.
in the medical field as, oh, don't worry about it, but
Because
we're
it's
finding out
not,
now that
yeah.
that's just not true.
Okay, and that makes sense here. So we really do need to have you and have so many more people
Right.
giving us the awareness so that we can find out more about it. So now on the 29th, what time should we be there?
I would say be there by like 8:30.
Be there.
Registration starts at
8:30.
9.
Okay.
And we're going to start the walk promptly at 10, so we give a little bit of time for vending,
Okay.
you know, information, and just kind of connecting, networking.
Okay.
You know, we're going to have a little exercise, you know, stretch a little
Oh,
bit
dance
before.
and
Little
exercise.
dancing, a little fun. It's really entertaining. It's a big family event. It's a family
Yes.
affair. You don't have to participate in the walk, but come and sit on the sideline, support everyone that's in, you know, that's there. It's really great
It's
just to
really
be
great.
in the atmosphere. It really is.
Okay. And do we need to sign up ahead of time? How do we do it?
Yes, you can go on to races2run.com. You can sign on and register that way as well.
Okay.
There are some things that we do manually, but we would like you to go on to the website and register that way also.
Okay.
Again, we don't want to turn anyone away.
At all.
So please, if you're interested in coming, please come on down. It's going to be a great family affair, and you will be very well educated when you leave there and empowered with information. So.
Very good, very good. That's so important. There are so many people who are still in the community who are living with
Yes.
this, and that we really want to support them, and we
Yes,
want to just give as much education as possible in
Yes.
so many different venues here. And we have the expert now. So I am here and I'm learning so much more. So now we're going to go to your Health Advocacy Award. So
Yes.
congratulations.
Thank you.
Yes. It's great when you're acknowledged for all your hard work.
And I want to thank the person who put this up, as was very honored and kind of surprised because, you know, when you're out here, and as I said, I've been doing this for a while, I felt so lonely because it's so hard when you're a visionary to for people to support and really understand why it's important to support sickle cell and make sure that there's resources for those living with the disease. And so all of these years, I've met so many challenges along the way, and people are saying, well, you're not a MD doctor, so that doesn't make you knowledgeable about sickle cell, to you know, just people sort of challenging you or saying, oh, it's just never going to happen, you know, those type of people. And so when you're an entrepreneur and you're a visionary, it can be a very lonely place at times because it's hard to get people to kind of buy in to your model of care and your vision and really support it. And so it's just nice to know that there are people in the community that have been watching my growth and that they feel impelled to honor me. I can't say enough about that. That really is exciting.
Well, and obviously very well deserved. I mean, in these just few minutes, I hope many of you have learned a lot. I've learned so much just listening to you. Again, so many times we hear sickle cell and we know, you know, the basics that they teach you, but listening to you, I've just learned so much more in this short amount of time. So I can imagine what you bring to your patients, what you bring to their families. And it's great to have someone like you. I know whenever you are, you know, learning something or dealing with something, having someone like yourself really comforts a family. It does. It's like somebody cares.
Yes, absolutely.
So that's so important to know, because a lot of times when you're dealing with medical or you're dealing with people on that side, they seem kind of just interested maybe in statistics, or they're kind of robotic in numbers.
It's not a personal experience.
And so to have someone who cares and who's interested in actually how you feel and just helping you understand and know that it's not just one way. So even acknowledging that, even if you don't have full sickle cell, just having the trait can bring you into some of the same symptoms is major, because so often people will just kind of dismiss you. And so having someone like yourself who embraces rather than dismisses, I'm sure is just great for the people. So on November 4th, you're gonna get this award. And this is with the
NAACP.
Yes, all right. So we need to support, we need to buy tickets, we need to come out and cheer you on for all of your hard work. We want to say thank you ahead of time, and congratulations on this honor that is so well deserved. You truly deserve this. All right, so now you got so much going on here. How do you? I thought I had a lot going on. But you got a lot going on. And so I guess you can teach us all a little something about time management.
I don't think I do that very well.
Because I'm looking here, it's like, oh my gosh, there's more. So tell us more. What else do we have?
So I just wanted to let the community know that also I've done work on the national level with Pfizer Pharmaceuticals. And I serve on the Council for Change Committee. We developed guidelines, best clinical care practices to treat persons with acute sickle cell pain crisis. And as Shay was saying, that's really important. Time is of essence. When they come into the emergency room in crisis, that we triage them effectively and that we get their first dose of pain medicine in right away so that we can ease that pain. And so we developed guidelines. It was a hematologist, myself, I represented the nursing side, advocates from across the country came together to put this report together. So now we have best clinical care practices that we put together, and we also enhance the science of sickle cell disease. Because a lot of times people feel like James, who looked completely healthy.
Yes.
It's a invisible chronic condition that
Right.
they're not suffering,
Right.
and that we now have scientific evidence to show what the pathophysiology looks like of a person going through a crisis.
Okay.
And so that's really important from the science side to really make sure that the healthcare profession understands that this is validated,
Okay.
and they are experiencing this, and that sickling that's going on in the body is a real experience. And now we have the evidence that there's certain biomarkers, prostaglandin synthesis, which is a big term for inflammatory markers that are also coming together in a cascade of events, depriving the body of oxygen and nutrients. And then on the advocacy side, we're working on really trying to educate healthcare professionals about implicit bias, so that when a person comes into the emergency room, that they would triage them the same way as anyone else that comes in. And we don't want to think that every person that comes into the ER is a drug seeking.
Okay.
And so that we're really working on that. And then empathy, really
Okay.
trying to understand that this is a chronic condition, it's very complex, and that as healthcare professionals, we have to constantly keep those things in mind as we evaluate and we treat them.
Wow. And I guess it's so hard for me to hear that someone would come in and that the healthcare people would feel like they're coming in for a fix, or they're
Absolutely.
not really experiencing pain, or it's amazing to me that this day and age that you would still, I mean, the sickle cell's been around for a long time, and we've had
Over
awareness for a
100
long
years.
time.
I have some
So
stories for
to
you.
know that, this is just happening, and people are, I guess, just getting the guidelines even is amazing,
Yeah.
because best practices really help us in so many ways. So
Absolutely.
people may not understand how great that you honestly we need to bow down to that group, because it is nice to have something to look at, to say, hey, you know what, this is the best way, this is what we should be experiencing. We can say, hey, did you know that there are
Right.
when we're educated for something like this, we can kind of empower ourselves when we encounter somebody who's probably not as loving as we'd like them to be during that time.
Yeah,
So-
and it's really important for the healthcare institutions here in Delaware to collaborate. Though I'm a small business, I have the knowledge and the expertise and work a lot on a national level, really trying to implement changes to really increase patients' access to high quality of care. And sometimes that's not always embraced. So I would say from the community that I'm really, really trying, and it's challenging, but I think we need to do a better job in Delaware.
So now we're here and we know what you do to support. How do we support you? Let's say the community saying, you know what, we want to get behind you. What do we do to get behind you?
I would say you can go to my website, www.tovacommunityhealth.org. I'm sorry.
So Tova is
Tova means good in
right,
Hebrew.
right, but spell it out for us.
Oh,
so someone
T
may
as in
not-
Tom, O, V as in Victor, A,
Okay.
communityhealth.org, to learn more about my organization. My model of care is very community-based. We don't necessarily just treat the pain of sickle cell, but we treat the whole patient. As I said, sickle cell is a very complex chronic condition, and so just treating pain is just not good care.
Right.
And then some of the other things I think is just making sure that Tova stays sustainable, and that we continue to have the resources to provide services to adults with sickle cell, but also making sure that the hospital institutions that garner 90% of the healthcare market allow small businesses like myself, for people to have the opportunity and the choice to seek other types of models of care that may benefit them.
Okay.
And one other way to get behind this is to donate.
Okay.
You know,
Yeah,
one
and that's
important
what I wanted to say.
Yeah, the most important thing, right?
One important thing that we do is, and this is based on my experience, is we try to offer support financially to the families who have someone living in their home with sickle cell, because our own personal experience, our Delmarva bill was extremely high. Needing to get a medical alert from the doctor to make sure your Delmarva didn't get cut off, because there are things that are running constantly if that person needs it. James, for example, needed oxygen 24/7 at one point, and that ran you know, he had a machine that ran throughout the entire house. So, you know, just to kind of give back in that manner. There are other ways too, but that's one of the ways that we give back to try to help those families. So they simply just apply, really simple. You know, if we have the funds, we're going to go ahead and pay that bill for them. So,
Absolutely.
So donate.
That's
donate.
right.
Yes.
So
Donate.
We also help to send them to the dentist, so we'll help them with their co-pays with that. That's really important. There was a study done at Johns Hopkins done by my colleague Sophie Lansgren that showed that persons that have poor oral hygiene actually have more sickle cell crisis and more hospitalizations. That was clearly linked to their oral health.
Wow.
And so, you know, part of that is not just looking at the pain, but we think about your teeth, your eyes, you know.
Everything.
So we really try to help with them as well.
How you're feeling, because I'm sure that's a lot as well.
All of that matters.
Yeah. All right, so now I'm peeping. So everyone knows I have a little cheat sheet here that's telling me all of her greatness.
No.
So I see in my cheat sheet that you are expanding. You get some help. You're in Philly and Atlanta, or tell us how you are helping in those areas as well.
One of the other visions that I worked on in the 90s with my colleague at Thomas Jefferson, Dr. Samir Balas, is I ran a transition program. So I made sure that my patients that were at the age where they had to leave the children's hospital and go to an adult sickle cell program, I wanted to see what their experiences were like over a 10-year period.
Okay.
And so we tracked those patients for 10 years, and we looked at their morbidity, the amount of disease that they had, and their death rates as well.
Okay.
And the reason being is because at that time it was really difficult getting resources for the transition program, and to be able to really impress upon that transition is an important part of life for these young adults, and that their journey is continuing on, and that we're asking them to be adults at 18 to 21, but that's just so many things were falling through the cracks.
Yes.
And so in 2017, I published my research in the Journal of American Hematology, and I'm presenting that at the National Sickle Cell Disease Conference that's going to be October the 11th to the 13th in Baltimore. And then I'm going to compare Philadelphia to Atlanta.
Okay.
So what we found is that geography plays a big part as well. So, you know, in Atlanta, the weather is nicer. You don't have the changes in temperature, which affects people with sickle cell. But I also think the infrastructure is a little different in Atlanta than it is in Philadelphia. And so I'm going to compare the two, and hopefully be able to share enlightening information to the community from my 10-year study.
Again, I applaud you for all that you do. I mean, it's amazing to think that you do so much, and obviously care so much to track people for 10 years, to give back and, you know, let everyone know what the study has shown us, and then expect some changes, or expect someone to react to the information that you're giving, because thanks to you, we can't not know.
Exactly.
So people are saying, why? What difference does it make? Because
it makes a lot of difference.
It does. You can kind of show a blind eye to things if you don't have someone like yourself who's tracking and who is credible to say, okay, we've seen this, and this is what we're showing. And we see in so many other areas where it's hard for young people to transition into adulthood. But to acknowledge that even, and again, there's so many times we're not faced with it, so we don't think of it. So I would have never thought about how it would affect someone with sickle cell. But now that you've put it in my face, I got to say, oh my gosh, this is major. Because here you have someone who is dealing with so many other things, and then you add this giant piece to, you know, all of the concerns. I mean, and anyone there who has an 18-year-old knows they're special people sometimes.
Yes, absolutely.
So let's add this to it.
You got
it
that
gets
right.
more difficult. So you're right. And then that 10-year journey, because it takes them that long, you know, to try and kind of figure it out. So to have you there helping with that is major, or at least tracking it to bring awareness.
Absolutely.
And that's what I think is key for everything that we're saying. I'm looking at the time. I don't know if I'm going to be asked back because I think I've gone way over the time I was going to
I wanted Aben to show a picture. I have Mr. Russum. Aben, can you put that picture up?
Please.
Please. Aben.
So what we're doing is we're waiting in the studio. We have a couple of pictures that we want to show, and this one is of someone who is living with sickle cell. Oh, there we have him. All right.
I wanted the community to see that that's one of my patients, Mr. Russum. He is 77 years of age, living with sickle cell, and he actually placed in his age group about 3 years ago. But due to bad problems with his hips, he's still very active, and he's really excited about attending this year. But I want the community to see someone that's in their 70s, late 70s, still alive, living very well with his disease.
So now, am I allowed to ask you? So what? Somebody has to give me a cue if you want me to shut up, because I have lots of questions, and I'm sure many of people at home have lots of questions as well. So how does that? How's it affected where we can lose James so young? I mean, and is it care? Is it knowing early? Is it early detection? Is it medical? Is there any rhyme or reason?
Honestly, I would say it depends on the severity and the complications that a patient has. Particularly, every patient of mine is different, and they all have their special complications and problems that they experience. And so I just want to say that there was a study done, again, by one of my colleagues that showed that people with sickle cell that live into their 70s or 80s, it really wasn't the medical care that really led to their longevity. It was having good family and support.
I was going to say that.
Yeah, okay. So that's major.
That's major.
That's major there. So, and that's what I wonder, because I know sometimes we get things that's like early detection or early intervention or, things like that. So it's just full love, strong support.
Love, I think that's most important. And then second, just having a good primary care or provider that really sees them on an ongoing basis, knows them very well.
So now, do you serve, and I don't know if you can answer this question on air.
Sure.
I want to call you later. But do you serve to help people find primary care doctors that have been just more loving than others, or have seemed to be more understanding than others?
I do. And in fact, when I do get people that ask, can you find me a good primary care doctor? I'm always there. Then I, ask if you prefer a male or a female. But I do have a list of providers that I've worked and colleagues that I work closely with, because I really believe that a good relationship with your primary care provider is very important. And so you can't really, if you don't develop that relationship and that trust, then you need to find someone else. And I'm always very open and honest with my patients as well about that, because you can't really provide good quality of care if you can't establish that.
Okay, so let's give your contact information one more time, because that is so important.
It is.
So if we want to get in touch with you, how do we do it?
My office number is 302-429-5870, or you can email me at contact@TOVA, T as in Tom, OVA communityhealth.org. That way as well.
All right, so I see down here, I think, one more picture, right?
Yes, I have a picture of James.
Well, I know it'll be there. And all of you are going to say, oh, I know him. No, it doesn't seem like that long ago.
No.
It doesn't seem like that long ago that he was with us.
Yes.
And as we shared, just so full of love.
Yes, absolutely.
Yeah, he was definitely just a loving, sweet person. Sometimes you get people, that's why I can't think of pain, because sometimes you get people in pain, they get a little irritable, it's a little
not him.
stuff. And so to think that he was enduring so much, to
he was
know
private.
that
He was private in the beginning, you know, and kept that personal, but it was important that he, encouraged them to kind of share that information, because he helps so many people. He helps so many people.
Definitely.
And family support is key, because without lack of family support, that can trigger stress.
Okay.
Which can bring on a crisis, so that was very important.
Okay. All right. So I think they're going to find our picture. We're not going to give up on them with everything that goes on here. Again, so I guess they're telling this because they want us to say again. All right, September 29th. Get out there at 8:30. Registration starts at 9. It's $10 for children. So children
And
are considered
seniors.
what age? And seniors. Okay, good. Children and seniors. So children are
Well, students.
students. So that's where we
College
go.
students.
Students. So any age parameters there, or just that you're a student?
A student. We
Just
didn't put
a
any
student.
age
We
range
don't
around
do all
it.
that.
Yeah.
All right.
They're a student. They, you know.
Yeah.
Come on
Come
out.
on
$10.
out.
Yes.
That's
And
it.
seniors.
All right.
Yes.
Students
Yes.
and seniors are $10. Everyone else is $20. You've heard so much tonight. So if you're like me, you just now are, oh my gosh, I got to do something. So at least donate. So suppose
Yes, please
if there's
do.
so many things happening on the 29th, you're like, I don't think I can get there. We can still donate. So
Yes.
let's get your website again so we can donate.
Okay. Well, it's going to be under Tova's
gonna be under
website. Under
Tova's
Tova's
website,
website.
okay.
Yes. Yes.
And they
So-
can also go to www.races2run.com.
races2run.com. So
Yes.
so important that we give financially. You can see
Yes.
where it's going. Sometimes we wonder, what on earth happens with our donation? Well, we
Absolutely.
know
That's
your
fair.
donation is going back to touch families
Yes.
and right where they're needed. And
Yes.
it's so important because sometimes people who are above things have never experienced it.
Yes.
You know what I mean? They're like, all in this, I just got this job. And so I'm working here and it's a job because I moved here and I got a new job. Not to say that they don't have the passion, but it's just different when you are actually working with someone or you've actually experienced it.
Yes.
I think the motivation is just a little different than somebody who just gets a job. Not
Yes.
to put any of them down. I'm just
No.
speaking that I think you truly understand the need, truly understand, as you're saying, that empathy just becomes just magnified because
And if I can speak to that, it's
Yes.
important, that the whole family gets support.
okay,
For the children,
yes,
if there's a spouse or the
Yes.
caregiver, that is so important because it impacts everyone.
yes.
Everyone. Like my son had this comment. He would say, "Oh, we're going to Daddy's second home," which was the hospital.
Okay.
He spent that much
Okay.
time in a hospital that
Wow.
he knew that was his second home.
Okay.
So to provide the support for the children is needed.
Yes.
And that's another thing that we do as well is have a support group.
Okay, all
you know,
right.
so which is very needed.
So that's important to know. So your support group is when does it meet, or
It's
how does
every
it work?
second Wednesday of the month at 12 o'clock
Every second Wednesday of the month at
Yeah.
12
Yes. at my office, 213 Green Hill Avenue, Wilmington, Delaware, 19805.
Okay. All right. All right. So we're going to take a break as we find this photo and find out if I will ever be asked again to come on Community Crossfire. We'll be right back. All right, good news. I have not been kicked off. Thank you, Julius. We appreciate you. And I want to honor, I guess in a lot of greatness comes modesty. So please tell us your other achievement that we somehow forgot.
That's okay. In 2017, I was awarded Delaware Small Woman-Owned Business of the Year.
Whoa.
And to me, just amazing, because I never thought that the community would appreciate a model of care that can really deliver high quality of care and really set the benchmark high for adults with sickle cell, and that they would find that that's an important service and business model that could be sustainable. So I was completely shocked.
And I am, again, proud. Let's say I know you. We can say we rub shoulders,
we need to
right?
do more, you know?
With someone like yourself.
Yeah.
So what are some of the, because there are a lot of, we need to know how great that is, because there are a lot of small businesses that are owned by females in the state of Delaware.
Yes.
So for you to be honored, I think, is just, it's just no small deal. This is a really big deal here. And it shows, again, just what passion does.
Yes.
So I think, I keep saying this, but I think it's so important that we understand. And for you, so everybody who knows me knows I'm just like an advocate for young people. So I love young people. And I think it's so important that they see people like each of you, because sometimes we think we have to follow somebody else's dream, or we have to follow somebody else's model. But to know that you saw something that you liked, you did what you like doing, obviously, and looking and finding out and, making it work. And you've made a difference in so many lives. You're actually being acknowledged for the differences now. Because sometimes people, you wonder, well, who will know or what will happen?
Exactly.
Surprise, people do watch and pay attention to your greatness. And, of course, girl power. We just keep seeing that. So, again, not a lot of young black females in the medical side who do STEM. That's encouraging. There's so many ways that each of you are encouraging young women, all young people, but definitely young women who wonder, what is it that I'm doing, or what is it that I can do, and do I make a difference? And what if I don't want to follow the model? Or what if, life happens and it gets hard? And you have to keep going. It's hard. It's a struggle. It's pain, but we keep going.
And I've had a lot of financial struggles.
And that's important to know.
For people to know, it's not easy. And I'm not shooting to be Oprah. Let me let you know. I just want to be able to pay my bills and be able to build wealth in my community. So I feel very passionate about that. So I think, young people need to know that there are entrepreneurs that don't want to be Bill Gates or Oprah Winfrey. We want to have a sustainable flow of income, but we also want to make sure that we're giving back and we're serving the community. And so I think it's important that they see examples of people trying to do that.
Yes. All right, so we probably only have seconds left, so we're going to have to just give the quick version of your, just tell us what you did, how you did it. You went to school, and you worked hard. So tell us what your early, because I always get young people. So when you were in school early on, how tough was it?
Very, very tough. Very, very tough. That's all I can say. There were times where I didn't think I was going to make it. I was going to graduate. But I just really pushed and never let anybody tell me I couldn't do it. But as I was saying to the community, I come from a family that were entrepreneurs. My family, we own 100 acres of farming land in Georgia, and we've been farming for 100 years.
Wow,
3 generations of farmers, and then my uncle owned a liquor store, and my cousin owned a laundromat. So I've always grew up in the business and know the importance of working hard, and know that, as you know, farming is not 9 to 5, and it's a 7-day-a-week job. So seeing my uncles have to get up at 5 o'clock in the morning to get out in the field to make sure that they tended to all of their crops, and then working from sun up to sundown, I knew the value of hard work, and I knew that I was going to have to grind. And to be able to see examples of that was really important. And then My father always said that if you get your education, so I graduated with my doctorate from Jefferson, you go back and you serve the community. And so because sickle cell was such an unmet need at the time, and I wanted to see if I could make a difference in that area, I chose to go into that direction. Though I had a wonderful, lucrative career working with children with cancer, I was like, there's a need here. So I decided to go in that direction.
Isn't that nice? Okay, amazing. So again, you definitely are very well deserving of all of these accolades that are being bestowed on you at this time. I, as a community person, thank you.
Thank you.
Again, for everything that you do, and being such an example of a fine woman, an entrepreneur, a hard worker, everything
And
that
to
happens
see others
here.
start their businesses is exciting as well.
Yes, definitely. So there's so much. I think I'm out of time. I have been blessed to be here the whole time and not get in trouble now. But I hope that everyone here has learned a lot. We definitely encourage you to, we've got a couple of dates here. So first on the 29th, we're expecting to see everybody who can come out. We're also expecting everybody who can't. Just give us, even if it's a small donation. You'd be surprised with small donations.
Yeah, so
Sometimes
that's how
people
we,
think donation means I got to give a big thing. But donation means you're giving from your heart and you're giving what you can. So any donation is fabulous. And again, on the 4th, we want to support the NAACP as they honor you, because you deserve it. We want to show our support here as well. And thank you to both of you. And thank you to Community Crossfire for allowing me to do this. And I guess they'll see them next week.
Thank you.